Second video, you're going to use a chair. So we should all have some kind of chair in the house or something you can hold on to, just for a little bit of stability. We're just going to get warmed up by standing to the right hand side of our chair, keeping our hand on our hip, and we're just going to lift up onto our toes and back down onto our heels, keeping our spine nice and long. So again, shoulders back to ears, stand up really tall, just warm up through the ankles and the calves. Just a few more little raises. Cool. And then we're to bring your knee up towards your waist and just slide the leg back and forwards, so just warming up through your hip. So point the toe, extend the leg, back, try not to arch your back as you send the leg away, give your bum a wee squeeze as you take the leg back, just warming up through your hip. Good, and let's see if we can take the leg out to the side this time. So stay nice and upright, try not to lean in, just warming up through our glutes, and again warming up through the hips. Just a few more. Cool, and let's do it on the other side. So we'll start with the calf raises, we'll just do a few little calf raises. If you don't need the chair, don't use the chair. It's there just to give you a little bit of assistance, just a wee bit of confidence to know that you're not going to fall. Good. And then bringing your left knee, just swinging it up and extending it back. Bringing it up towards the hip, squeezing your glutes as you send the leg away. Perfect. Focusing on the core, keep it nice and tight. And then let's take the leg out to the side. So flexing, standing up super tall, standing the leg nice and strong. Good. Perfect. Good. Right, I want to come back to side number one, and all I'm going to ask you to do is see if you can step back into a little lunge and then step back. So all the load is through your left heel and the back leg steps back at 90 degrees. So if I was to show you that side on, you'd be dropping the knee, front leg at 90 and the back leg at 90. So the back knee is under the hip. So holding on with your left hand for support. If you don't need the support, you take it away. That's it. So this is something you could easily do in the house by yourself, just to make sure that your full body is getting a little bit of work. Good. Right, next time, let's see if we can bring the knee to your waist. So bring it up at the same time, focus on your core as you bring your knee up, engage your belly, keep your spine nice and long, and try not to bring your chest forward. Keep your chest nice and upright, and you should start to feel everything in your body start to feel a wee bit warmer, and your heart rate start to climb a little bit. Good, let's try that on the other side. So right hand on, left leg back, drop the knee, and just step in. Maybe just do 8 to 10 on each side. You're thinking about your breath, so breathing in to step back, and then breathing out to bring your knee or your foot back through. When you're ready, start to bring the knee up towards the waist. Again, chest up nice and high. Don't know about you, but I'm getting a wee bit warmer, and I'm getting a wee bit more out breath. Brilliant. Again, 8 to 10 on each side. I'm not generally counting. Okay, let's just come round and let's see if we can sit onto the chair. So everybody can go to the toilet, we can all squat. So if you can sit on the toilet seat, you can squat. So hands are going to come to your temples, feet are hip width are slightly wider, and your toes are turned out. So I want you to sit, push up to your heels, lift your toes up, come up to a full stand, sit back down to the chair fully, and your hips come through and you give your bum a squeeze at the top of the movement. Again, when you sit back into the chair, you're going to breathe in. When you drive out the chair, you're going to breathe out. Good, so with the legs going, let's see if we can add some arms this time. So let's work the shoulders too. So thumbs come back to shoulders, hands extend all the way to the sky. Again, we're breathing in to sit down, and we're breathing out to rise out the chair. Good, again, something you can easily do in the house, by yourself, sitting back to a decent level. Well done. Cool, right, and rest. So this time I want to hold onto the back of the chair. One hand comes to the chair for support, and one leg is on the chair. Make sure that your heel is not hanging off the chair, that your full foot is on, and you're pushing up through your heel. If you wanted a bit more support, what I would suggest is perhaps coming to a wall, holding onto the wall for a bit of stability. Okay, so I'm just going to pretend I'm holding onto the wall here. I'm going to stand up and squeeze. My wall is in my left hand, pushing up through my heel, squeezing my bum at the top of the movement. Just a little functional movement that you do every day, stepping up, stepping down, all on the one side. Again, 8 to 10 on each side, and then switch. Yeah, so I'm going to do this one without any support. See if I can do it without support, and if it's too challenging, I'm going to place my hand back on the wall again. Yeah. So always when you're doing exercise, make sure you're working within your own means. You don't take risks. You do something within your comfort zone. Don't push too hard. Yeah. And if this is too high, try and find something that you have around the house. It's maybe just a wee bit lower and that you can work with. Yeah. Okay. So this time what I want to do, take your chair, and you are going to have your chair out in front with your hands at the edge of your chair, coming onto your knees. So if you want to make this nice and easy, get your knees under your hips, and you're going to drop your chest to the chair level. If you want to, bring your knees further back. Again, you'll see you've got a nice line from my tailbone right up to the top of my head. My elbows are going back to my sides, and I'm going to drop my chest all the way down to hit the chair level. Yep. So I'm going to breathe in, and then I'm going to breathe out. Breathing into the